And I've got my coffee here with me. Um, Hannah, you've got controls of the screen, right? All right, awesome. Uh, so today I'm excited. When we do these speaker series, we frequently visit and revisit topics like myths and facts about homelessness, or we talk about encampments or housing. A lot of the work we do, but today's topic, talking about addressing substance use, is a new one. And so this will be the first time that we're talking about this topic on a speaker series. And I think it's a real privilege to have our team here with us chatting about this topic. So I'm excited. I think y'all are in for a treat. Before we get going, though, I want to just set a little bit of context about homelessness in Houston and the work that we do at Search. If we can go to the first slide. So we recently got the results of our 2024 point in time count. And the point in time count is done once a year in Houston. These point in time counts are done all across the country. And every community has their own methodology of how they do their count. It is not a perfect count, but it's made to be almost like a census that gives us a year after year look at how we're doing. And the count is used to help establish where the funds go from HUD, federal funds that help relieve homelessness. It's used to help paint a picture of the improvement that we're seeing or where we still need to do work. And in Houston, we look at this number to show the drastic reduction of homelessness that we've seen since 2011. I'll talk about that more. But in 2024, we saw that on any given night, that night in January, we saw just over 3,280 people were homeless on any given night. And how that translates over the course of a year is that just over 26,000 men, women, and children will experience homelessness throughout the year. And that means that people dip in and out. Some people's homeless experience is really short. It's just one night. They spend a night at a shelter and they're resolved. And then, of course, we know that some folks experience homelessness for the whole course of the year, every day, day in and day out. Next slide. So as I mentioned, since 2011, Houston, that number, it's drastically reduced. So back at the height of Houston's homeless epidemic, right, we were seeing over 8,000 people experiencing homelessness. Houston had one of the largest homeless populations in the country, and we were receiving a lot of additional funds and support. We received additional TA from HUD to help us address this problem. From there, we've had this drastic decrease across the years to 2024. Overall, it's been a 61% decrease, which is really incredible. It is unbelievable. It's leading the way across the nation on how to improve homelessness. And what's remarkable is that most of the other cities are seeing increases, or they're seeing steady states. Even when you look within Texas alone, just comparing our local neighbors, they're seeing quite the opposite. You're looking at cities where the state and the city have lots of funding. They're pouring lots of money at the problem. Look out at the West Coast, right? Where they're giving millions of dollars to homeless services. And they're seeing the opposite of what Houston is seeing. Relatively, Houston has very little money in homeless services, and yet we're doing an excellent job. Next slide. What's also exciting is that our PIT count, or point in time count, when you compare it from year to year, so last year to this year, it stayed relatively flat. It's a difference of 10. But what is important is that our unsheltered and sheltered number is a number we look at. We compare how many people are staying out on the street versus how many people are in emergency shelter. Both of those numbers, both of those types of categories are folks that we consider homeless, but we want to see that our unsheltered number is going down, right? We want to see that we're putting people into temporary housing, even if it's just shelter. And we saw that. We saw that from 2023 to 24, that our unsheltered population got smaller. That's that orange part. and the sheltered population got a little bit bigger, that bluer part. And part of that is because this last year, we've poured a lot of resources into outreach. That's been some of the results of the COVID funding. Search is really dedicated to outreach. We have multiple outreach teams, including an encampment decommissioning team. It's been one of the main focuses. The way that you end homelessness is that you get people off the streets and into housing. Shelter is one step of that process. And so getting people into shelter is a good signal that we're heading in the right direction. Next slide. And of course, everybody wants to know how Houston is doing this. And it's very complicated, but in the most simplistic terms, the way that we're doing it is through collaboration. It's the spirit of what we call the way home. It is all of our partners, all of the agencies all over Houston that do this work. We come together and we've created a homeless response system. Instead of each agency doing their best and trying to help people, instead we all come together and we've created one coordinated approach. We all agree that housing is the solution to homelessness, and we all do what we each do best. And together, we're working to end homelessness. So through doing that with coordinated answers and coordinated responses, and also coordinating our funds and our dollars, we've been able to maximize our impact and our outreach. We also all agree in a housing first model. And so this approach is still debated across the country, but housing first is essentially the belief that you put people into housing first. You don't ask people to meet different minimum standards before they have the basic human need of housing. You don't require sobriety. You don't require that people meet a certain income threshold or that they adhere to certain protocols. Doesn't mean that people don't have consequences, natural consequences, or that they're, immune to the certain things that happen in life, right? Like they still have tenancy rights. They still have to follow a lease. They still have to adhere to paying rent, all of those things. But you don't hold housing and shelter as a carrot. Instead, you put people into housing, and then from there, you see that people thrive. And the results show that that is true. When you do that, you see that people are able to improve the quality of their lives. They access medical, mental health, behavioral health. Their income does improve. Their housing stability improves, because once they have a safe place to call home, all of those other things can fall into place. And so Search follows this model, Houston follows this model, and it's what's led to Houston's success. So I think it's from here that I pass it over. Oh, there's one more slide, sorry. So at Search, we have multiple programs that all fall under our case management umbrella. This is what Search does best. We specialize in behavioral change, right? Helping people make the change once they decide that change is for them, that they want to and are ready to move off the streets and into housing, or if they haven't decided to make that change, we help them get ready to make that change. We engage with folks at all different stages of change and readiness, and we help guide them towards housing, because again, we believe that housing and wraparound care and support is the solution to homelessness. We help people maintain their housing, increase their income, maintain healthy and stable lives. And overall, we're really trying to increase their community and their sense of well-being. And so all of these things spread across all of our programs here at Search, and they're intertwined in lots of different teams and all of the work we do, but it all falls under this kind of umbrella of case management and support. So from here, I'm going to turn it over to our amazing team here who's doing peer support work. I think it's probably Phoebe, right, that I'm turning it over to take it from here. All right.
Thanks, Alexis. Can you all hear me? Okay, great. Please excuse my scratchy voice. I'm not sick. I just have terrible allergies from all this stuff in our Houston air. But I'm excited to be with you all today. I actually have a task for us to start off with, which is, it'll feel a little bit like we're back in school. What I'd like for us to do first is to do some unlearning together to dispel some of the myths that we might hold about the relationship between substance use and homelessness. And then we'll do some relearning together about the realities of how these two things do intersect. And then after that, we'll really get into the heart of our time together, which is looking at how we actually address substance use in the work that we do at Search. And in other words, right, like this, the topic of our speaker series suggests, we'll explore how we help someone move forward in their journey, not just of getting housed, but of healing from addiction. So we will get there, but first, let's take a step back. I imagine many of us here at some point has seen somebody who looks like they don't have a home, and maybe they're hanging out at a street corner or below an underpass, holding a bottle in a brown paper bag, right? So you may have had this image just from seeing somebody in real life, could be from a movie, from a TV show. But the assumption that often comes with this image is that many people become homeless because of their addiction to alcohol or substances, right? We assume that that's the correlation. That guy on the street corner with the bottle doesn't have a home because of his drinking problem, right? It's a myth that's deeply ingrained in our society. And I would say it's not hard to believe, right? So I'm going to ask Hannah to advance the next slide. So we'll look at some numbers together. Okay, so take a look at the numbers here. You'll see the first row is the general population, right? So you'll see this is all based on self-report surveys, right? So we can reasonably assume that the percentages are probably higher, right? But this is kind of what's self-reported. So in the general population, about 11% of folks report that they abuse alcohol. About 17% report they abuse substances, right? And so when we zoom in on the homeless population, this is looking nationally, right? About 38%, so almost 40% report abusing alcohol. About 26% report abusing substances. So you can see it's significantly higher than the general population. And then in case you're interested in local data, right? So this is data that was most recently collected within Harris County and a couple of our surrounding counties. About 26% of our homeless population locally report abusing either alcohol or substances. So they just kind of lump together those two behaviors. But you can see, right, from this data that there is a disproportionate representation of alcohol and substance use within the homeless population, right? So when you look at the data, and then when we think about these images and these anecdotes that often pervade our society, it's not hard to conclude that substance use and alcohol is a driving factor in a cause of homelessness, right? You can probably sense a however coming. So here it comes. However, right, let's take a deeper look at this. Let's kind of break this down a little bit. So according to data from our public healthcare system, about 10%, probably a little bit more, 10% of people who seek substance use treatment report being homeless. So that begs the question, what about the other 90%, right? Why is it that so many people who do struggle with addiction do not end up becoming homeless, right? There has to be other factors involved. And so you can go to the next slide. Hannah gave you a sneak peek. So this is what Alexis has been sharing a little bit about, right? We often share this at Search, that the root cause of homelessness in our nation is not these individual factors like substance use or mental illness or losing a job, but it's really lack of affordable housing. So let's consider some other data, right? So if we think about the correlation between substance use and homelessness in our nation, we might reasonably expect that the places that have the highest rates of drug use would also have the highest rates of homelessness, right? But when we look at the data, there's actually no correlation between these two issues. So for example, West Virginia has the terrible distinction, unfortunately, of having the highest drug overdose mortality rate in the country. So it's up here. It has one of the lowest rates of homelessness in the nation, right? And this bears out kind of state to state. There's no correlation between substance use and homelessness. You can imagine, right, that the one data point that does correlate with homelessness and the rate of homelessness in the nation is affordable housing, right? So the places that have the least amount of affordable housing and the highest housing costs typically have the largest homeless population. And the converse is true, right? So like Alexis shared, here in Houston, we've used affordable housing with services from agencies like Search as the solution. And you could see from that graph, right, that homelessness has steadily decreased. So hopefully this helps us start to unlearn some of the more simplistic and less accurate correlations between substance use and homelessness that is so prevalent in our society. So I'm going to get off my soapbox for a bit because I feel like I can sound preachy when I talk about these things, just because I get so, fired up about it. And I want to pivot us, right? So let's do some relearning together. Because if substance use is not a root cause of homelessness, there's obviously still some kind of relationship there, right, between these two issues. So what is that relationship? So next slide, please. So I'm going to share 3 realities that we can consider. The first one is that substance use does increase the risk for potential homelessness. So it is an individual factor that can make people more vulnerable to homelessness. And here's the key, when they're also facing a lack of affordable housing, right? So affordable housing mixed in with any one of these individual factors can increase someone's risk of becoming homeless. The second one is that the experience of homelessness itself can lead to alcohol and substance abuse. So we often think about it like that, like addiction leads to homelessness, but we tend to not consider the other way around, right? That homelessness itself could trigger or exacerbate addiction. And for me, I've heard so many stories personally from our clients about how their experience of homelessness was so stressful and traumatizing that the way they learned to cope with it was to start drinking more heavily or to seek out a substance that, even if just for a moment, would help them escape the nightmare of surviving on the street. And I would say this rings true even for the house population, right? Some of us here may not have experienced homelessness, but may have experienced addiction or known someone who has, right? And for those of us who have experienced childhood trauma, chronic stress, mental illness, a lot of times alcohol and substance use starts out as a way of coping. When maybe we didn't know of other ways or didn't have other ways to cope. And then this coping mechanism often can become a full-blown addiction. And by that point, it's so hard to get out. So the third reality I wanted to share is that people experiencing homelessness often face more barriers to accessing substance use treatment than the general population. In other words, it can take people without homes far longer to get help for addiction than someone with a home and with greater stability. So for example, if you're surviving on the streets and you have your ID stolen while living on the streets, and every treatment center in town requires you to provide some form of ID, how are you going to get help? Another example is that, most folks who are homeless here in Texas do not have health insurance, but most treatment facilities require insurance and are not affordable without it, right? So again, how do you get help? So unfortunately, the experience of homelessness and poverty itself can prolong someone's addiction and delay their ability to get help. So I know these are some kind of sad realities that I'm sharing. Thankfully, the story doesn't end here, right? It's not all doom and gloom. So I want to move forward to the heart of what we'll talk about, which is so then how do we address this very complex and difficult issue of substance use here at Search? So I'll share a few quick points with you, and then I'll turn it over to Sarah and Nick, who know far more than I do about this. So first point is just kind of driving home what Alexis shared about housing first, right? Is just know that we do not require people to be clean and sober in order to enter housing programs, right? We recognize that people need that basic stability to even start thinking about letting go of the coping mechanisms they know and leaning into a new life. Second, we see addiction not as an offense that must be punished, but as a need that must be understood and addressed along with all the other needs that we address, whether it's, financial needs, a need for housing or food, health needs, right? We address it just, along with those things. Despite our intent and posture of trying to address substance use openly and non-judgmentally, as you can probably imagine, addiction just comes with so much stigma and shame and struggle that it's often really hard for our clients to open up about it, much less to allow us to work with them on it. Our clients will sometimes express to our staff, and this is what they expressed to me when I was a case manager, is, how can you, Phoebe, how can you really understand what I've been through? How can you relate to how hard it is to get out of addiction? And so a major lesson we've learned here at Search is that those who are most effective in helping our clients recover from addiction are people who've been through it themselves. So with that, it is my pleasure to introduce the team lead of our peer recovery services, Sarah Butrans. I'm excited to have Sarah here to share her knowledge and her wisdom with us.
Thanks, Phoebe. Hi, everyone. Thank you all for coming. I appreciate it. So my name is Sarah, and I'm a person in long-term recovery, and I'm also a former Search client. And I say all that to let you know that recovery from substance use, homelessness, and mental health challenges is possible, and not just for me, but for anyone. So today I'd like to talk a little bit about what that can look like for our clients and how peer support fits into that. So first off, I'm going to define what peer support actually is. The short version is a peer support specialist is someone with a particular life experience helping another, and there are countless examples of this throughout history, like 12-step model, mutual support groups, that kind of thing. So we use our lived experience and the things we learned along the way to offer support to our clients as people who've kind of been there and done that. We're non-clinical. We're especially trained members of our clients' care teams who work with case managers, medical staff, and other members of the team to provide kind of a wraparound support for our clients. Here it's a 5-person peer team, and we all use our experience with recovery from addiction to walk alongside the people we serve as they walk their own path to recovery. So peer services by their very nature are completely voluntary, so clients cannot be mandated to work with us. It's always their choice. We empower our clients to make those decisions for themselves in a world where they don't always have the power to do that. So when a case manager first sends me a referral for a client who has a substance use issue and is interested in working with a peer supporter, I will either call the client or go on a home visit along with the case manager to kind of do a face-to-face meeting with them. And I will introduce myself and give them kind of a brief snippet of what my recovery journey looks like. And then I listen as they tell me about themselves or whatever else they think is important for me to know. Listening is a huge part of what I do, and sometimes it's the most important thing that I do. I've had several clients tell me that I'm the first person who really listen to what they have to say, and really that's a gift I don't take lightly. Sometimes people will open right up to me, and sometimes it takes them a while to warm up, and whatever their preference, I go at their pace. Once we've established a relationship, I can wear a lot of different hats. Some days it's just listening while they tell me about something important to them. Other times they may need me to link them with a drug or alcohol treatment program. I go to recovery meetings with them and act as kind of like a tour guide. I help link them with community resources like peer-run wellness centers, food pantries, support groups, that kind of thing. I will also accompany them to court dates and doctor's appointments. I advocate for them and show them how to advocate for themselves with doctors, judges, case managers. Sometimes I help to translate doctor speak when the client is feeling really overwhelmed or has a hard time making sense of what's being said, because let's face it, we've all been there, right? In fact, recently I sat with a client as she checked herself into a mental health facility, and I kind of walked alongside her throughout the whole process so she wouldn't feel so alone. I am a cheerleader when they accomplish their goals, and I'm a shoulder to lean on when they're having a hard time. Above all else, I try to provide hope that things can get better for them. You know, a lot of the time people think that they're just kind of stuck where they are and that things are always going to be that way. And I consider it a real honor to be able to say to them, you know, I've been where you are, and if I can get better, so can you. So when I was dealing with my own substance abuse struggles, I found myself taking a week-long vacation in a mental health facility. One of the very, very few good memories I have from that time is there was a guy there who was most likely a peer supporter, although I didn't know what that was at the time. He always spoke to me every day about what my life could look like when I got out of there, you know, which is something I hadn't considered up to that point. You know, he was very kind and very patient with me, and he let me talk to him. And he offered me a little glimmer of hope that things could change if I wanted them to. Sadly, I don't remember his name, but I will always remember his kindness. So now that you know kind of what it is that we do, I'd like to share a little bit about how we as peer specialists fit into the picture when the client is using drugs or alcohol. First and foremost, we are non-judgmental. You know, I regularly tell my clients, like, if you're drinking or using and it's not causing you any problems, then that's none of my business. However, if you decide you want to do something different with your life, then that's when it becomes my business. But see, I mean, they're tired of having people breathing down their neck about their substance use. And so if I show them that I'm not there to tell them what to do, it can open up a real dialogue. Since our services are voluntary, the very fact that they want to work with us shows that they're willing to at least start thinking about making some changes in their lives. Because we've been where they are, sometimes they'll tell us things they wouldn't tell anyone else because they trust us and they know that we're a judgment-free zone. I personally know where they are because I've been there myself, you know, stuck in that hamster wheel that is addiction. I understand that we don't always have a choice when it comes to our addictions. You know, I was so tired of alienating myself from my, you know, from my friends and my family. I was so isolated, and I just wanted to stop using for so long, but every day I'd wake up and I would find myself chasing the dope all over again. And I can see that desperation in my clients' eyes, and all I want to do is help them find a way out of that insanity. And sometimes it can take a while, but you know, we work with our clients to help them achieve small, manageable goals, and we celebrate those wins with them. We use a strengths-based approach to highlight what they're doing well, even if they experience a setback. So teaching them to look at setbacks as kind of like a learning experience can be a huge shift for them. I mean, it can mean the difference between them giving up and them continuing to move forward. So little by little, they start to make some progress, and no matter how long it takes or how many detours they take along the way, we stick with them and we show them that there's at least one person who's in their corner no matter what. Often clients aren't sure how to even start their recovery journey. Some of our clients come from homes where they're surrounded by drugs and alcohol and they've never known anything else. Others may have started using to numb the pain that comes from trauma. You know, there's a lot of trauma that happens to people when they're living on the streets. And if you don't have time to heal from that trauma, it just compounds and compounds and compounds. So since they have yet to resolve that trauma, using seems like the only thing that can help them. You know, it's their only coping mechanism. So we peers use our experience, strength, and hope to offer them alternative coping skills and start introducing them to people in the recovery community so that they can have some sober supports outside of Surge. You know, having a support system is really key in helping somebody to get and stay sober. We may be that first member of the support system, but we encourage them to find themselves a tribe. You know, they're a little group of people that they can call their own, people they can call on when things get rough or they start thinking about drinking or drugging. So many times I hear clients say that they're staying sober by keeping to themselves and staying away from everyone. And my question to them is always, okay, but what are you going to do when you inevitably have to go outside, right? You know, keeping to yourself just isn't sustainable. So we help to introduce them to safe people they can hang out with and have fun with. And we also take them to kind of recovery-oriented events like the annual Sober Chili Cook-Off. So they can see for themselves that they can have fun without drinking or drugging, because let's face it, if you're not having fun in sobriety, why do it, right? We can also help teach them social skills so they can maintain those relationships that they form. Speaking for myself, when I was on the streets, all I was doing was surviving. You know, there was no time or need for social skills or anything like that. So when I finally started to get it together, I had to start from the ground up and be taught how to interact with people appropriately. So I know that's a lot. And I say all that to say that, you know, peer support is individualized. So it looks different from client to client, and what works for one may not work for another. So we have to constantly keep learning new skills and techniques so that if something isn't a good fit for someone we're working with, then we have more tools in our tool belt to try out. You know, we do whatever it takes, and that's really the name of the game for us, is just doing what it takes to help people see their own value and start living lives that they can be proud of. So with that, I am now going to turn it over to Nick Darrow, who is one of our peers here at Surge, and he's going to share a little bit more about what peer support looks like for our clients.
Hello, everybody. I am Nick. I am a peer recovery support specialist. And, you know, I was kind of looking at listening to Sarah, and I wish I would have just went first because she, you know, she basically, you know, nailed it with the explanation of what it is that we do. But I kind of wanted to dive in a little bit about a personal experience that I had working with one of our clients when I first started with Search. This was about 3 years ago, I want to say, and it was with a gentleman named Arthur. I remember, I think it was maybe my third, fourth day, you know, coming into work, and this specific place was Harrisburg. It's one of our congregate sites. I remember getting out of my vehicle and walking up towards the front, and I couldn't help but notice Arthur, you know, just kind of walking around, and he was staring at the ground. And I realized he started picking up cigarette butts, and I was like, you know, I approached him and I said, "Hey, man," you know, I'm introducing myself. You know, I said, "Hey, you know, my name's Nick. You know, I'm the peer support specialist here, man. And if you ever want to chop it up or talk, dude, let me know." You know, and he said, "Hi, my name's Arthur." He didn't really make eye contact with me, but I could see in his face, you know, that I knew, right, that we had shared the same soul, the same spirit, because I could see that. You know, I could feel it. You know, because I had been there, you know, a lot of times, right? Um, and so I knew that I had to be tactical with Arthur, right? And being tactical, creative, trying to find a way that I can, you know, start up a conversation and build rapport with him, you know, and try to slide my own experience and what it was that I did in the mix. And it started kind of with a joke. And I said, you know, when he finally said, "Yeah, man, I'll meet up. We'll meet up one-on-one." He approached me. It was awesome. And I said, "Cool, man, let's meet up." So when we met up, I said, "Yeah," I said, "Arthur, man, let me tell you something, bro. When I did that, I picked up Marlboros only. I didn't pick up the Newports, bro. I was looking for Marlboro specifically." And he laughed, you know, and he goes, you know, and it was like we had that moment, right? And it was like something so but anyway, from then on, you know, we hit it off, right? I told him a little bit. That's when I was able to kind of open up and tell him a little bit about my story and, you know, being homeless myself. I was also a Search client, you know, and I'm proud to say that, right? Because, you know, it's one of the biggest assets that I have today as being a peer, right? Is getting to talk about my experience and then the strength and then give them hope. And so doing that with Arthur, you know, I see his face lit up every time we met thereafter. And so, you know, I got to know a little bit about him, his background, you know, family, you know, so I asked him, I said, you know, Arthur, when is it that you wanted to start, you know, because he had brought up his substance use to me prior. And I said, when are you ready to, did you want to do anything with that? Right. And he said, not right now, Nick, I'll let you know though, you know, and I had to respect that. We meet here, right? Even though my mind wanted to say, Arthur, you get started, bro. Wake up, you could do this. I promise you, I did it, you know, and just shake him. You know, obviously I couldn't do that, but I wanted to. And so, you know, you fast forward, I want to say maybe 3 or 4 months, and I'm in the office and he unexpectedly comes in and he says, Nick, I'm ready to go to treatment. And you know, I was like, well, okay, well, let's get started. Let's get to work, man. Let's see what options we have and you know what you would want to do or where you would want to go and for how long. You know, there's a process when, you know, getting our clients into treatment. Sometimes there's a lot of you know, barriers that we have to overcome, which could be like insurance or you know, lack of you know, income thereof, right? So navigating that sometimes can be you know, could be tricky. So I remember one place in particular that we drove to actually had him do try to do a physical, right? So they were trying to make him do jumping jacks and push-ups and you know, do these lift. And I'm over there going, he's not going to boot camp. This is called the open door mission, not the open door boot camp. You know, this is that anyway. But anyway, so yeah, anyway, I told Arthur, I said, listen, man, you know, if this is the place for you, if this is what you want to do, it's up to you. Hey, he goes, no, I'm not gonna, I don't think that this is what I need. And I said, all right, man, I didn't want to tell him I agree with him, but I said, all right, man, let's let's go find some other places, right? And so we finally found a place. I didn't know, and he didn't tell me this, and I probably should have asked him that he had health insurance after we were looking at all these different places, right? That were like, you know, nonprofit or state funded, and so we found him a good place that he said he wanted to go to, and you know, we kind of expressed his butt all the way there, and you know, I remember him getting out of the car and him looking back at me and saying, man, thank you. So I get to see those moments, right? He was scared. I know he was scared. I said, listen, bro, I promise you it's going to be all right. Just do what those people tell you to do. You know, just do what they tell you to do. You're going to be all right, man. I got to be there to, you know, to kind of, yeah, lessen the nervousness, right? And so I'm going to try not to keep dragging on. I'm sorry, y'all. I get real passionate about this. You know, so he ends up calling me. If you fast forward maybe 3 or 4 months later, he ends up calling me and he says, listen, Nick, I'm not coming back to housing. I actually got set up with my own little apartment. You know, you know, I've been sober and, you know, and he started taking pictures of his apartment. He said, listen, man, I know it's not much. He said, but look, he took a picture of his living room, his bedroom. He had like a little mattress laid out and everything. And he said, I know it's not much, but it's mine, you know? So yeah, he said it even has a pool. I was like, okay, heck yeah, man. You know, so I get to have those experiences. So you fast forward now, present day, I think he has a little over 2 years sober, and he is part of the board of directors. You know, so I mean, he's kicking butt. You know, and I always look forward to seeing him and talking to him on a regular basis. He checks in with me. You know, and so that's just one example of the many that I get to experience. You know, working here at Surge. You know, the mission is to provide hope and creating opportunity and to transform lives, right? And I think with Arthur, he was getting all three. So yeah, I think that might be it. I wrote a script. I'm not going on it right now, so but I think that might do it for my part, y'all.
Yeah, that was awesome. Thank you so much, Nick and Sarah, for sharing your, yeah, not just your experience, but also your insight and wisdom, and especially for your generosity in sharing bits of your own story with us. We don't receive that lightly. So yeah, hopefully for those of us here who've been listening, you know, we've been able to unlearn some things about substance use and homelessness, relearn some of the complex realities, and just be inspired, right, by our amazing peer staff, but also our amazing clients, you know, who are the ones who really make this journey, this difficult journey, to the other side, to, you know, to housing, to healing, from a very difficult experience. So this is kind of the end of what we wanted to share. So we wanted to open it up for questions. So if you do have questions, comments, things you're curious about, feel free to type it in the chat box. And this is a pretty small group too. So if you prefer to unmute yourself and just ask your question out loud, feel free to do that as well.
And it doesn't have to be about anything we talked about specifically today. It can be about search in general or homelessness in general. It doesn't have to be about substance use specifically. Anything? You got a quiet bunch?
This is Naomi.
Hi.
Actually, I don't have a question. I just have a comment about how incredibly impressed I am with both Sarah and Nick and this, you know, you've talked in the past about your outreach program, but this is just extraordinary. Because I know from my own past, when you talk about childhood trauma, that some of the best people to discuss it with are those who have been through it themselves. In fact, the first time I was in a group and I realized, my God, there are other people like me. And I felt like I found my own kind. And so the fact that you take this approach, and it's not the what we can think of as the typical approach, which is to try and force somebody into seeking help, instead of basically being there and supportive of them and not being judgmental, and then letting them make the decision, because frankly, that's when it's going to succeed, is when they make that decision and that choice for themselves, instead of somebody literally pushing them into it, or you're going to stay on the street, or something bad is going to happen, or we're just going to ignore you. So that's why I love coming to these seminars you put on, because each time I learn something so extraordinary, and I love being able to pass that information on to get rid of some of these stereotypes. So thank you so much for this program. I'm just amazed and delighted and impressed. So thank you.
Thank you. It's wonderful to hear. Yeah, I think for so long there was kind of a common, a lot of teams, a lot of agencies had, you know, LCDCs on, and LCDCs are great, licensed chemical dependency counselors, still a very, you know, needed part of all of this work. I think it was actually a grant that we had that allowed us to have our first peer recovery specialist. It was part of the grant. And this was many years ago. Phoebe and I both worked in programs together, and I mean, I still remember the conversation. We were working to design what the future would look like around our substance use work, and we made an intentional decision that this was going to be the future, and we designed in more peer recovery specialists. And the dream is to have a peer recovery specialist on every search team, and we're getting there. I think at this point, do we have a peer attached or working with almost all of it's with? We have somebody touching every one of our PSH programs, right, Phoebe?
Just,
Or Sarah? Yeah.
oh, sorry. Yeah. We just have
All but one?
5 programs
Yeah. Okay. So we're just short on one, right? That
currently.
doesn't. Yeah.
Working on it.
Yeah, we're working on it. So I mean, that's the hope. And we've even, brought peer recovery work into outreach. So I mean, we'll continue to keep doing this. We know that it's the right model for everything you just said. So anything else? Any other questions, thoughts? All right. Well, thank you all for joining us today. And we sure appreciate your time. Of course, thank you to the amazing team at Search as always. Great job, guys. All right. Bye, y'all.